Oh, look, there's different recipes that have been used, so and no one knows which is the best. And as I said, no one actually knows if it really will benefit in the long run either. But typical recipes are a dose every second week, 4 doses every 3 months, 2 doses or four doses and then a month off. I mean, the trials have used different things in that regard. One of the things that's also been shown in that situation is that if you do special tests to look for very small amounts of the myeloma, even though it's not detectable with the standard tests, with that extra treatment you can even see it going down lower still. So, you know, that situation, I don't think it's clear what the right recipe of the Velcade is. All of the recipes certainly seem to have some benefit in control of the myeloma, but whether that means that in the long term you'll live longer, or whether that means that when your myeloma comes back you can't use the Velcade anymore, this is not going to work, that's not worked out. So some people might stop their treatment then, that would probably be the commonest situation. Some people will keep going.
And it would change with every individual?
It would, yeah. At the moment, there's no one way to treat myeloma, that's clear. There's a lot of evidence for lots of different types. Yeah. Well, anything else?
Side effects, specifically peripheral neuropathy, is that reversible?
Not always, no. Typically, it improves after stopping the drug. But, yeah. Oh, sorry. The question was about does neuropathy as a side effect improve? And the answer is usually it improves somewhat after stopping the drug. In some people it goes completely away, but not always. In most, when it improves, people can be left with numbness or tingling. But in some people, it can be a nasty ongoing problem requiring medications, and you know the nerve damage can be permanent. So it's not a simple side effect for some people.
What would the time frame be with that, doctor?
Oh, look, yeah, look, nerves can grow back, regenerate at 1 centimetre per week. So if you got it affecting your feet, you know it can take a year for some sort of regeneration to occur. So if you've had the nerve problem for 18 months, 2 years, that's probably what you've got is what you're going to be left with. Yeah.
With peripheral neuropathy, is it fingers and toes, or can other parts of your body be affected as well?
So there's
Like knees or ankles? Or
so peripheral neuropathy is, this is a medical definition thing, is related to the peripheries, to the fingers and the feet. But nerve damage can not only be peripheral neuropathy. So it can affect the nerves, for example, that control your bowel. So you can get diarrhea. It can affect the nerves that affect your blood pressure. So you get wonky when you stand up, feel like you're blacking out. It can affect the nerves that affect sexual functioning, so you can be impotent. So you know, other nerves in the bodies can be affected. The peripheral neuropathy is the commonest sort of thing. Typically it's feeling, but if it gets more advanced you get weakness as well. So not just the nerves of feeling, but the nerves that control strength. Yeah.
I've recently read some news reports about the measles virus in relation to
Right.
in America.
Yeah, so the measles virus is a way of delivering a whole range of things to cancers, not just myeloma. And so if you can direct the virus to the cancer cell and not to elsewhere in the body, so you can introduce, it's good at getting into cells, so the measles itself can kill cells, or you can put things in the measles virus to introduce it into cancer cells. So there's a whole raft of things. That's been around for a long time, hasn't really progressed to anything yet.
So it's still the experimentation stage?
Oh, there's been trials in patients, but they, you know, generally if something works, you keep hearing about it. So there's, you know, it's research that's going on, but I haven't heard anything really promising about it. Yeah. Yeah.
Excuse me, it's going to get quite a way in your
Blab.
Yeah, strength with respect to the peripheral neuropathy. Do you just simply get into a bigger regime fitness to sort of counteract that, or is it just go as hard as you can, or just keep rattling it?
So the thing about neuropathy is the best thing to do is to prevent it in the first place. And that, there's not actually much you can do as the patient in terms of that. It's very important that you are monitored closely for symptoms, and doses are reduced if those symptoms come on. So it's useful, for example, some of the drug companies make little neuropathy scores that you can tick the boxes and see whether things are getting worse or better. Some of the symptoms are very difficult to pick up though sometimes, you know. Sometimes the initial symptom can be a bit of a cramp or something. It doesn't seem like it's necessarily a nerve problem but a muscle problem. There's been a lot of things trialled, a lot of vitamins, various supplements to try and prevent neuropathy or make it less common. None yet have been shown to definitely work, but there's bucket loads of things that can be tried. Once you've got the neuropathy though, there is no doubt for a whole series of reasons that if you can maintain physical activity, that is very important.
So
Now,
pretty much effectively go as hard as you can and just
I wouldn't say go as hard as you can, but some people who might be limping around may find that very difficult. But certainly if you can maintain muscle tone, that can make the most of what nerve damage you've got. It won't actually reverse it more quickly. I don't think there's evidence for that, but it can certainly help you cope better. Everything is more difficult when you lose strength and fitness. Pain becomes more difficult to handle. One of the big problems with steroids, you know, they're part of every myeloma recipe just about, and that's because they make any recipe more effective. But they do waste muscle. They're not a bodybuilding steroid, they're the opposite. They're a muscle wasting steroid. And so it's very important in myeloma as much as possible to maintain physical activity. Yeah, look, getting back in the gym's fine. You shouldn't be lifting heavy weights though with myeloma. Sometimes the bones are not... got to be a common sense about it. But in terms of doing things, particularly particularly if you enjoy the gym, you should be doing it. Yeah.
We went to one meeting where it was said that if you have satin sheets, it's much easier if you've got neuropathy. It's better if you keep
Yeah.
it neat.
I reckon that's something that you try it, and if it helps, certainly you can imagine that it might be easier when you move around in bed if you've got highly sensitive feet. That if they're not catching on something, that would be something that would be beneficial. So, but I imagine that will be different between people. Yep.
With regards to the lenalidomide, I've been on it for 12 months, and I'm just wondering whether I'm going to get cut off it because it's not being funded anymore.
So I don't know the situation that you're in it on, but if you were, the answer is almost certainly not. So if you're on it on the PBS, then no. The only reason that you have to get it stopped is if the myeloma progresses, in which case you don't want to be on it anyway, but it's not working. So that's the only restriction the government places on it, that your myeloma is being kept under control. Yep. So just feel happy that the government's giving you a $120,000 gift every... We don't actually know what the government pays for it. They negotiate it in confidence between themselves and the company. But what they call the list price is extraordinarily expensive.
Well, according to the box that I get from the chemist, it's, I think it's just under $7,000 or just under $8,000 for 20.
Yeah. Well,
Thank you, Ted.
no problem.
Thank you very much.